How do I get rid of my back pain? Let's talk about what causes back pain. It's typically due to some sort of injury, either an old injury or new injury or combination. And many times patients don't know what the actual cause was. They're not aware of it. And it can be difficult to pinpoint the exact cause of the pain, especially if the symptoms are coming and going. Let's first look at some of the structures in the spine to get our bearings. Okay, so we take a look at the spine. The spine has vertebra, bones, and there are cartilage joints at each level in between each set of bones. There's also a disc, the intervertebral disc, which acts like a shock absorber in between each of the vertebrae. The disc is really important because if things get out of place, it'll stretch the disc and the disc will swell. So here's a close-up of what we're talking about. This is the back of the spine and the front. You can see the discs, and then you can see the gel center that acts like a shock absorber, like a bushing that absorbs the shock. So if things get out of place in the spine, that disc will swell, and because the disc has nerves going to it, you'll feel some pain. But also, because the disc, if it swells, it'll swell into one of these bigger nerves that comes out directly from the spinal cord. Now these are the big trunks that come out of the tree. So these nerves will cause a lot more pain, but also a variety of other symptoms because there's a lot of diverse information coming through these. Anytime things get out of alignment in the spine and there's swelling in that disc, that inflammation is going to cause a lot of problems, pain being one of them. I've kind of outlined the top 9 solutions for this pain and inflammation that I've experienced in listening to my patients over the years. So I've helped at this point literally thousands of people with back pain, and I've listened to see what kinds of things they're using and what they got benefit from. So number 1 is probably icing. It's the most common solution for back pain. Icing helps the blood vessels constrict to get the swelling, the fluid in that area to kind of dissipate, and that helps with the pain level. Also, it helps numb the area, obviously, so that helps. The downsides are that it's not always practical to ice your lower back. You know, if you have an analgesic, a topical analgesic. This is a great one, by the way. They can be really great for mimicking the effect of ice. But if you're going through your day and working and stuff, it's kind of hard to do it all the time. Also, if you're high on the pain scale, you know, if it's really hurting a lot, pain isn't going to touch it quite as much. Which leads me into the second, which is NSAIDs, non-steroidal anti-inflammatory drugs. This is your Motrin, naproxen, ibuprofen, over-the-counter anti-inflammatories. They help a lot with pain. The downside is, you know, if you take it for too long, you're doing damage to your liver, kidneys, and your digestive tract, but also you get a dependency built up, and it doesn't work quite the same way. A lot of patients get prescribed opioids, which are your stronger painkillers, especially if they have higher levels of pain. These drugs do work, but there's a big risk of dependency that goes along with it, so you really want to be careful about using them. Massage is another real popular way to deal with back pain. It feels good, it's relaxing, and if you've been in pain for a little while and you're in that heightened vigilant state where you're protecting yourself, massage sounds pretty good. The problem is that when there's an injury, the muscles go into lockdown mode where they're in spasm to protect an area. They're trying to splint it and keep it from moving so that it can't get injured any further. So when you're in that state and you're trying to massage those muscles and get them to relax and get the area to start moving, it can cause more inflammation and more pain. And it can cause kind of a reflexive tightening of the muscles even further. Which leads me into strengthening and stretching. These are typically employed by physical therapists. Stretching is really good. You want the muscles to be limber and is resilient from injuries like sprains and strains. And strengthening is really good, particularly the core strengthening, because that helps the body stabilize and support itself structurally. And the problem is if you're injured and you're trying to strengthen an area, you run the risk of injuring it further or re-injuring it. Same thing with stretching as well. Sometimes it's not ready to stretch. You really just need to listen to your body and hold back, modify as necessary. A lot of patients have come to my office over the years already wearing a back brace, like a corset for the lower back. It splints that area and gives support and also keeps you from getting into movements that would cause it to get injured more. So it's really effective, especially in the acute phase. So in the initial phase, the acute phase, the tissues are really have the most damage, and you really want to limit motion there the most. The downside starts to occur as you keep using the back brace. So over time, you're going to get used to anything that you're doing, whether it's NSAIDs, opioids, or back brace. In the case of a back brace, it's going to kind of cause the muscles that are normally supposed to support that area of the spine, it's going to cause them to atrophy and weaken, so that when you're not using the back brace, you're actually more vulnerable to injury. Another solution that has worked for some, but not all patients, is acupuncture. Acupuncture is a 5,000-year-old Chinese healing art that deals with meridians and energy fields in your body. Some patients swear by it, and some patients just don't get the results for whatever reason. So if you're one of the people that does get great results in terms of pain relief from acupuncture, fantastic. And if you don't, the downside is not that severe. You're just out basically your time and your money. Some patients have to turn to surgery as a solution for their back pain. This is a decision that shouldn't be taken lightly, because it's really hard to reverse it once you have surgery done. Surgery has downside. It's very invasive, obviously, and sometimes it works and sometimes it doesn't. So I always recommend with patients that they kind of seek out more of a conservative plan and try things more on the conservative spectrum, and really try and fix the problem with an easier fix first, and then kind of work their way up as appropriate. In my opinion, surgery should really be your last course of action, and you should avoid it if you can. I also want to urge you to try chiropractic care. Chiropractic is proven effective at treating lower back pain, and there's really very little downside. Chiropractic works by eliminating the structural cause of the pain. So I want to emphasize that. It's removing what's causing that pain instead of just trying to mask it or cover it up. And it allows the body to heal the injury, and thereby reduces the swelling and the spasm, and the pain dissipates and goes away. If you have any questions or comments about any of the 9 solutions that I've talked about, or if you have any questions about chiropractic care, feel free to call my office at the number listed below. And I really hope it's been helpful for you, and I hope that one of these solutions, or a combination of them, will be the ticket for you to kind of get rid of the cause of your pain and to start living your best life.